The Academy is sharing important ophthalmology-specific information related to the novel coronavirus, referred to as Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2, which was previously known by the provisional name 2019 nCoV. The highly contagious virus can cause a severe respiratory disease known as COVID-19. What you need to know. Several reports suggest the virus can cause conjunctivitis and possibly be transmitted by aerosol contact with conjunctiva. Patients who present to ophthalmologists for conjunctivitis who also have fever and respiratory symptoms including cough and shortness of breath, and who have recently traveled internationally, particularly to areas with known outbreaks, China, Iran, Italy, Japan, and South Korea, or with family members recently back from one of these countries, could represent cases of COVID-19. The Academy and federal officials recommend protection for the mouth, nose, and eyes when caring for patients potentially infected with SARS-CoV-2. The virus that causes COVID-19 is very likely susceptible to the same alcohol and bleach-based disinfectants that ophthalmologists commonly use to disinfect ophthalmic instruments and office furniture. To prevent SARS-CoV-2 transmission, the same disinfection practices already used to prevent office-based spread of other viral pathogens are recommended before and after every patient encounter. Background. The SARS-CoV-2 is an enveloped, single-stranded RNA virus that causes COVID-19. Patients typically present with respiratory illness, including fever, cough and shortness of breath. Conjunctivitis has also been reported. Severe complications include pneumonia. Symptoms can appear as soon as 2 days or as long as 14 days after exposure. At this time, there is no vaccine to prevent infection, and no medication known to be effective in treatment. Ophthalmology ties. 2 recent reports suggest the virus can cause conjunctivitis. Thus, it is possible that SARS-CoV-2 is transmitted by aerosol contact with the conjunctiva. In a Journal of Medical Virology study of 30 patients hospitalized for COVID-19 in China, 1 had conjunctivitis. That patient, and not the other 29, had SARS-CoV-2 in their ocular secretions. In this larger study published in the New England Journal of Medicine, researchers documented conjunctival congestion in 9 of 1,099 patients, 0.8%, with laboratory-confirmed COVID-19 from 30 hospitals across China. While it appears conjunctivitis is an uncommon event as it relates to COVID-19, other forms of conjunctivitis are common. Affected patients frequently present to eye clinics or emergency departments. That increases the likelihood ophthalmologists may be the first providers to evaluate patients possibly infected with COVID-19. Therefore, protecting your mouth, nose, e.g., an N95 mask, and eyes, e.g., goggles or shield, is recommended when caring for patients potentially infected with COVID-19. In addition, slit lamp breath shields are helpful for protecting both healthcare workers and patients from respiratory illness. Questions you should ask to identify patients with possible exposure to SARS-CoV-2. Does your patient have fever or respiratory symptoms? Has your patient or their family members traveled recently? Red flags include international travel to countries such as China, Iran, Italy, Japan and South Korea, and domestic travel to states with high numbers of infected patients, e.g., Washington, California, New York. The healthcare providers who encounter patients meeting these criteria to immediately notify both infection control personnel at your healthcare facility and your local state health department for further investigation of COVID-19.